Hi, welcome back to the channel. I'm Jess, and today at Live UTI Free, we're continuing the discussion about preparing for your UTI appointment. Dr. Carley Akehurst and I sat down to chat about the importance of setting clear goals and expectations. You'll want to stick around for this because the insight that Dr. Akehurst shares from the clinician perspective may be invaluable to you achieving effective communication with your clinician. I also want to mention that we recently launched a membership program, which gives you the opportunity to join live community calls and share your ideas and feedback with the Live UTI Free team. You can join by following the link in the description. Lastly, if you enjoy these videos, think they're important, and want to support what we do, be sure to hit subscribe and tick the bell so you get notified of future videos. Other than that, thanks again for joining us on this journey to bettering women's health everywhere, and enjoy the video.
Treatment, even if that clinician just reads one thing on that form and it's goals of treatment, the very first thing that's there, I already think that sets that interaction and that patient-clinician relationship on a much better foot than just how things are sort of done traditionally.
Good if we could now discuss the presentation of this form. So this is something that you're providing, that Live UTI Free is providing to patients. This is not something that is coming from a clinician's office. And so the clinician themselves are unfamiliar with this form and probably not expecting a patient to bring it in and present it. This can also be pretty intimidating for some patients to present information, as there's a lot of instances of patients being dismissed. Maybe they've been referred to as Dr. Google because they've spent too much time on the internet. And so what would be your recommendation as a clinician for how should patients approach their clinician to share with them that they've done some preliminary work for this appointment and they'd like to share that information that they have with the clinician?
That's an excellent question. And I think, unfortunately, it's a little bit clinician specific. So I know in my own practice, I have my own intake forms, information that I need to know, and I ask my patients to fill that out in advance so that I have time to properly review it. I also, in my own practice, ask patients to send any lab work that they've had, any relevant diagnostic screening that they've had, so I can start to rule out some things or review the lab work and be prepared for that first visit. Not everybody has that time, and not everybody necessarily likes to have that information. It depends on that specific clinician. This is where I actually think an office manager or front desk staff could be really helpful. So you could, let's say you speak to someone, they've given you your appointment at a certain time. You could call back at another time and say, I'd like to provide some information in advance of my appointment. Do you think the doctor would appreciate that, or clinician would appreciate that, or should I just bring it with me? I know that sometimes patients with chronic conditions, it's really helpful to have a binder of information. And I actually often encourage patients to keep that because it's helpful to keep a track of what you've been doing and a timeline of different things. You might want to, depending on the clinician and depending on how well you know that clinician, maybe keep the binder in the bag, in your bag, just for that first few minutes of the discussion. What I'm hoping is that the form would cue a clinician to ask for more information. Have you had an MRI done? And do you happen to have that report with you? Or could you send that report to my front desk? That would allow you to streamline that information. What can be overwhelming for a clinician sometimes is when a patient has lots of information to share. And so we're hoping that this form would allow that streamlining to happen. You can have all that backup documentation with you. So it's hard when you don't know a clinician yet and you don't know their approach. I would say it's also something to gauge is if you know or if you have heard that the clinician has experience with chronic UTIs or chronic bladder irritation. You might be able to send that form in advance, but office staff can often be really helpful in saying, you know what, yes, actually the doctor would probably appreciate that in advance. What I would advise is that you might send just the form in advance. If the office staff says, just bring it with you to your appointment, have the form prepared and filled out already, bring it with you to that appointment, have your first few minutes of interaction with the clinician, and then you can say, I've actually streamlined this information for you if you're interested in having a look. And again,
Yeah.
their response can probably give you information on whether or not that's going to be the right clinician for you.
Right. Yeah. And we actually have some information about that in a patient resource that we created earlier in 2022, was, gauging that response and determining if that relationship is right for you and your care and your treatment goals. So it sounds like from that if your clinician or the office staff says that the clinician would not prefer to have that information ahead of time, rather than, me walking in as a patient and immediately saying, "Here, Dr. Akehurst, here's all my information," that can be quite overwhelming. So maybe the patient should reserve that for later, or even if they never actually present the form, they have done the prep work. So whenever those the questions are presented from that clinician, their responses are ready. And as well as, we've written out some space for patients to prepare some additional questions or additional information that may belong to them. And so now they're not on the spot having to think of those questions, and they can even pull it out for themselves in reference during that appointment time. So it sounds like there's a lot of different ways that this can be used, and everybody should kind of try to gauge what would be best before that appointment, and then kind of adapt with it as they go.
Absolutely. I think in an ideal world, you would have all clinicians very interested and keenly aware and wanting to learn more. But the reality is of it is that there are restrictions on clinician time and understanding, and unfortunately, patience sometimes.
Mm-hmm. Yeah, it's a lot of information, so it makes sense, and hopefully it helps patients to gather an understanding of some of the challenges that clinicians face as well. We are all human, and so we do have limitations, and like you said, the time constraints and restrictions, and so I think that's hopefully really great that we're having this discussion for everyone to get kind of an inside look at that as well. So getting into a bit of the technical aspects of the form, I'd like to discuss the section that's current medical history. In specific, there is a column that is notated purpose of the product. Maybe it'd be helpful for us to share why this column is important. I can speak from the patient side of it. It's important to understand why you may have been recommended a product by a clinician. And as you're filling this out, if you realize that you're not really sure why you're taking something, then that might be an opportunity to look into that, reach out to that clinician, do some research. And then it can be important to have an understanding of why you're using a product, so you can, of course, what this whole form is about, so you can help to relay that to your clinician. So as Dr. Akehurst mentioned earlier, depending on the clinician's background and their specialty, they may not be familiar with a specific medication if they're more on the herbal side of things, and vice versa. A clinician may not be familiar with herbals or supplements. And so it can be helpful to have that information ready to present for them. Dr. Akehurst, why do you feel that this is an important aspect of this form for patients to be prepared to present?
So one of the things that I take really seriously in my role as a clinician is education. I think it's really important that a patient feels empowered and educated and understands why they are taking certain things or different aspects of their treatment plan. So this also, as a clinician, gives me a good idea of how much the patient understands, how much perhaps if they've been started on a pharmaceutical medication, they know why and the duration and how we're monitoring that. It gives a really interesting point of discussion with the patient to understand to get to know their understanding. The other thing that I noticed too is that within the Live UTI-free community specifically, or the chronic UTI community specifically, often there's a lot of information online about this supplement would be great for this, or this is how I cured my symptoms. And so often I find, or sometimes patients will take things that have been recommended online or by a friend, or perhaps by a different clinician that may not be, in my opinion, or a particular clinician's opinion, the best specific remedy or formula or medication for them. So for example, if a patient is taking a herb and they have put down that that's to treat the bacteria in their bladder, but we know that I know that that herb is not effective for that bacteria, that's a point of discussion where we can say, I actually think that there's a different medication or formula or herb or supplement that would be better indicated for you specifically. So it gives me a good gauge of patient understanding. There are also many herbs and supplements that are not safe for some patients to take. And so again, if this is something that's been recommended by somebody that maybe doesn't have the understanding of how we need to appropriately monitor for that, it gives me an opportunity to make sure that I know what the patient is taking. I know that it's safe. I know that if they need their liver, kidney enzymes checked or function checked on a semi-regular basis, that I can initiate that. So it gives me a good understanding of why a patient is taking something or why they feel that they need to be taking something.
Yeah, yeah, that makes a lot of sense. I think we've gone into a lot of detail about not just the form, but how this can benefit both patient and clinician in communication and this education and the relationship between the two. Is there anything else that you would like to mention to the Live UTI free community about this form in particular, or maybe interactions with clinicians in general?
Yeah, I think one of my favorite parts of the form is the very first part, goals of treatment. So it can be very easy as a clinician to get lost in the day-to-day and to think that or have a inappropriate belief that you know what the patient's goals of treatment are. They're here because they want to feel better. They're here because they want to be fixed, right? But it's actually a really big disservice to our patients to feel that we know what the goals of treatment are without asking or making that assumption before we get to know that person. So I actually think that the goals of treatment are really important for a patient to have in mind and communicate with their clinician, maybe not even on the first visit if it's just your first chance to meet that person, but over time communicating that to your clinician so that that doesn't get lost. Sometimes clinicians can make an assumption that a patient has an expectation of cure or an expectation of complete remission of symptoms. But sometimes a patient just wants to be able to live their life. And so an improvement of symptoms might be beneficial. It also allows us to understand what's the main thing that's really sent you to seek out support with this. Is urination keeping you up at night? Is your bladder so painful you can't sit down? Are you unable to lift your children because of pelvic floor concerns? Like, it really helps us to have an understanding and gauge where the patient is on their healing journey, are the primary issues that are bothering them at the moment, and communicate expectations for both clinician and for patient. So that's actually my favorite part of it all. And I think that if you get a clinician who's busy and thinks they know what's going on, but is willing to just stop for a second and take a breath and really hear what the patient is saying, having that goals of treatment, even if that clinician just reads one thing on that form and it's goals of treatment, the very first thing that's there, I already think that sets that interaction and that patient-clinician relationship on a much better foot than just how things are sort of done traditionally.
Yeah, yeah, I really love your insight on that. From the patient side of things, it kind of sounds on the surface almost as well, goals of treatment. And the patient may have that in mind, and we as patients may also be under the assumption that we all want the same thing as well. Um, but I think it's important to really explore that, especially as you get caught in that cycle of seeing different providers and researching and all of that, to really stop and refocus. It's also important to consider what your initial goal was when you set out to seek treatment versus maybe where you are now. Maybe you've made some progress along the way, or you've learned a lot, and those goals may be different now. So I really like the emphasis that you've brought to that section. So thank you, Dr. Akehurst, for joining us today and sharing more about this form. It was really great to collaborate with you on such a useful tool such as this.
It's absolutely been my pleasure. Thank you for having me. I'm excited to see how this form is used throughout the community. Yeah, so thank you for this opportunity. It's really exciting.
Yeah, we're excited to hear from patients, their perspective of it, and in sharing it with their clinicians. And we'll absolutely share that feedback with you as well. So thank you again.
Thank you.
Wow, I hope you saw the passion that Dr. Akehurst has for helping patients improve communication with their clinicians. She really gave new meaning to the importance of setting goals prior to an appointment and adjusting those goals based on the type of care that you're pursuing. If you'd like to learn more about this and related topics, be sure to go back and watch part 1 of my discussion with Dr. Akehurst, and of course, download your copy of the My UTI History Form. We'd love to hear your experience. If you like what we're doing on this channel, make sure to hit the subscribe button and tick the bell so you're notified of future videos. Thanks so much for watching, and until next time, keep educating yourself so you can advocate for yourself.